So here's a quick demonstration of our online lab portal, portal.avantgardedentistry.com, which every member of the Avant Garde community will be given their own login by our team. So first thing is log into your online portal and you will find the dashboard. Jobs, messages being the main thing, and also your archive work as well. To create a new job, you click on jobs. In the top right corner, create job. This gives you the basic options of the obvious treatments that you can be doing. Direct smile makeover for the injection mold technique, indirect smile makeover for ceramic veneers, miscellaneous, more basic, less than 6 units, implant planning, and clear aligners. For direct smile makeover, which is injection mold technique, create the job, enter the patient's details, name, date of birth, gender, and the practice that you are treating from. This will be automated with your login information, but it can be changed if you work at multiple practices. Enter your mobile number. This is quite important, as every stage within the design protocol, you'll be informed when you need to check the portal and approve something which has been put up by the lab. And the treatment date is automatically set at a minimum of 2 weeks from the date that you're putting the new case on, and that's just to follow again our lab protocols for our turnaround times. If there's special requests to change this date, then please contact the lab directly. We will always do our best, but please respect that we have lots of demand currently on the lab. Put in the diagnosis, whatever communication you like with the patient, any comments about the smile design, the smile makeover, the occlusion, any need for crown lengthening, any considerations, anything that you're going to upload with the images, such as a 2D smile frame, and all the things that we've discussed on our injection mold course. Very basic principles about the smile design, tooth shape and ideal texture. Do you want bleaching trays or whitening kit to come with the mock-up? It's very easy, as we will be printing models anyway, so we can provide you with bleaching trays and our Millionaire Smile Pro whitening kit. Do you want a mock-up design? Yes, please choose yes, as it's the pinnacle of all our workflows moving forward from the mock-up. Crown lengthening guide is available if needed, and it's nice from a smile design perspective to give the lab the ideal length of the central incisors so they can work their proportions from this point. Then we upload our photos and videos from our protocols given in our training. We know that the ideal smile photo is the full face photo for facially driven smile design. Video is always useful, and any other photos, there really can't be too many. If there's any 2D smile frames created at this point, you can upload it here as well for the lab. Sometimes you can upload them directly through the 3Shape, through the triage scan that you'll be sending. There is the option to skip the mock-up and go direct to the treatment stage, where the mock-up and the injection mold lens will all arrive together. Again, not something I advise. You know, the idea of the workflow is to have everything approved from the mock-up point between the patient, the lab and the dentist, and then you can move forward with treatment very easily and very comfortably. There's options for the impressions to be sent conventionally if you like. For an impression, just say that you've posted them on what date, or you can choose STL uploads independently, or you can choose, you know, your scanner, inbox, iTero, 3Shape, etc. Once that's all done, the job is created. That'll be sent to the lab to approve the work. The lab will be approve the work and they'll begin their design. The design information will be sent in this format: some screenshots of the STLs, basic information and comments from the lab, and a video uploaded with, you know, the basic principles of the design to be discussed from the lab back to the dentist. So these videos are usually around 1 to 2 minutes long. Please take your time to
This is a quite complex case because
have a look at these
the planning involves a bit of ginger
and understand some of the reasoning behind the design principles the lab has undertaken. There may be some questions on here that the lab want you to answer, and inevitably, as much as we would love to guide elements of the design, the function and the aesthetics, the overall approval and diagnosis and prescription has to come from the dentist, so we're waiting for the approval from you guys. But these videos are quite thorough and detailed and really help assist with the planning, as you can see in a case like this where it's a really complicated tooth wear case.
As you can see on our table, this is very important because this will allow us to change the bite as well as making space for new composite. So this is the design. So this is the upper. We have managed to get even proportional.
So Yaz is just currently designing the upper arch, determining the proportions, and the balance, determining how much crown lengthening or gum recontouring is going to be required, how much additional length and incisal edge is going to be required, and how that looks from an additive perspective from the pre-op.
So this is the upper and this is the lower. So as you can see here,
then the lower design is factored into the bite. The occlusion can be checked.
And build up the composite veneers.
You can see on the left side that the incisal pin has been opened 2 millimeters to open the bite to accommodate for the additive composite. You can see that on the pin there, and then we're just checking the articulation. What guidance has been created. All of this can be discussed and potentially amended before approval of the final design to print the mock-up guides to try in the patient's mouth. Like I always say, the best articulator in a case like this is the patient's mouth in the form of the mock-up, especially in additive big wear cases like this. You should be able to really test everything thoroughly through the mock-up in the patient's mouth live.
We have certain lines that allow us to see where the incisal edges are, and I will be able to show you in a second. Here we go.
Yeah, so now just start checking all the horizontal lines, make sure everything is balanced
incisal edges is right
and in line with the horizontal.
As you can see, everything is level, everything is
face.
in line.
Make sure there's no cancer in the smile.
Once I've done this, I will just show you the texture of the teeth in order to visualize. Yeah.
One final occlusal check.
Yeah, so this is the final design for the mock-up. So we will need you to try this in the mouth, and then we will be able to see if the patient is happy with it and if he agrees for a final design, which will include the gum contouring. Thank you.
So once the video has been reviewed and the STL files look like this, so we can see the pre-op situation and the additive situation, see how much length or gingival recontouring needs to take place. And again, this is open for discussion if it's too much, too little. It really gives us an idea of how this mock-up is going to be placed in the mouth and how it will potentially appear. It also allows us to communicate with the patient using these images on a screen where the addition takes place in length or from the gum position, so we can discuss crown lengthening and show them what the case would potentially be with or without crown lengthening to assist with the co-diagnosis. Once everything's approved, leave some comments based on your feedback of the mock-up and what's going to happen next. And then I'll be asking the lab to fabricate those models and the mock-up stent for the mock-up appointment. That goes over to the lab. Design files have now been approved, and the lab will print out the models, provide us with the silicon guide for the mock-up, and post that back out to us. We will then provide the appointment for the patient, put the mock-up in the mouth, take all the necessary photos, videos, and then upload these back onto the portal to provide necessary feedback to the lab on how the mock-up went in the patient's mouth. Everything was fine, all approved, so I'll leave those comments there to let the lab know that we were happy with everything. There are no changes. There is the option here to give potential changes you want to make and request a second mock-up rather than going ahead to fabrication of injection mold stents. Obviously this is on a case-by-case basis, but the idea is, as we say in our courses and our training, approve the mock-up even if you need to take 2 or 3 appointments to get the mock-up perfectly right, especially in cases like this where it's really complicated, dual arch, tooth wear. Get the sign off the aesthetics and function, and it makes the actual execution appointment very straightforward, very easy, very predictable, and very reproducible from the mock-up. So in this case, I'm saying to the lab, I'm happy. I'm now going to do the gum contouring utilizing the mock-up, and once I've contoured the gums, I'm going to send you a new scan to commence for the final fabrication of the injection mold stents adapted to the new gum position. So I'll be saying yes to the approval. No need to request a second mock-up, but it's an option. And then, are you sure you want to approve this mock-up and go to final fabrication? Yes. Then you can see there's a quick switch to treatment options. So even though we've chose direct method for injection mold stents, the workflow is exactly the same for indirect. And at this point, the patient may change that they want to go to an indirect option. So you could choose then for indirect options and ask for invasive models, final models, a new stent for provisionals, final design, as we've also touched on in our course. Or we can say the plan's still the same. Let's create the injection mold stents and move to that appointment. So we'll be clicking yes to that. Back over to the lab. They now need to fabricate the models and deliver the models and the stents ready for the injection mold appointment with the patient. Once they've done that, we will get a tracking number, and you can see there's a mail which comes through at every stage, giving me the tracking number so we can find out when this is going to land, make sure everything's on time. Tracking numbers there. And then it's over to us to execute the appointment and the treatment with the patient. Here's just a summary of the case so far. So it's always nice to have the patient in the chair for that appointment, and then we've got a nice log of everything that's gone on so far, all the pre-op images, all the design, videos and photos, all the mock-up, and it's really nice to have that available just to refresh before the appointment and also show the patients all the hard work that's been going on behind the scenes. Once the appointment has been executed and everything's great, we get some nice photos on the day, and we can leave some feedback for the lab about how things went. We love to have feedback to see how things went, see the work finished in the patient's mouth, and discuss further if there's anything that we could improve on all the time. We're constantly striving for improving, constantly looking for new ways and methods of improving things. So your feedback is really advised at this point. Show us your lovely after photos, and we'd love to promote these through our Avant Garde channels as well, because we'll have all your before, your mock-up and your final pictures through this portal, and we're happy to promote them with your permission. It's another good reason to give us all this feedback. The final invoice will also be sent with each case for you to view. Job feedback is left, and once you leave this feedback, that automatically then goes into your archive cases. So full case information from start to end will be available in your archives as soon as you've left the feedback. So this is a really nice way of having a one-stop shop for all of your smile designs from initial consultation, diagnosis, planning with the lab, mock-up appointment, final appointment, all in one place. So it really acts as a great holding database for all your imagery and communication. And there's our final photo, communicated back to the lab. Everyone was happy, results were fantastic. And that's it, on to the next one. Really looking forward to seeing your cases, guys. There's our email address. Lab portal is portal.avantgardedentistry.co.uk. Take care until the next video. Bye bye.